Okay, let's play a little make-believe. It's a typical Saturday night, you're relaxing at home, everything is fine, then suddenly a family member trips and falls and they've sprained an ankle, not life-threatening, but enough pain to require medical attention. And guess what? Your family doctor isn't back till Monday. What to do, where to go, who to call? If you are like millions of other Americans, you're probably heading to a nearby urgent medical care facility. And with us to share the good news about this quickly expanding medical industry is Dr. Michael Kaplan, National Medical Director for NextCare Urgent Care. So great to have you on the set.
Thank you, Julie. Appreciate it.
I remember when I was a kid, if something happened to me, my mom would call my doctor. She could call him anytime. He would come over. I mean, things have so dramatically changed. I mean, what has happened?
I think there's been two big fundamental changes. The biggest, I believe, is just access to primary care physicians. So access to your family physician.
Right.
It's been harder and harder, as you well know, probably to make an appointment for your family doc. They're scheduled several months out in advance. So access to acute same-day appointments at your family doc has been increasingly more difficult. So that's kind of drove patients to look outside of their family physician or primary care provider. And second, I think patients are looking for a cost-efficient way to get their health care. And insurance companies are looking for a cost-efficient method to provide services to their panel of patients.
They've come such a long way in such a short time.
Access to medical services for acute walk-in medical care has expanded enormously. In addition, technology such as electronic health records, additional clinical advances in the ability to care for people in an acute medical setting has also improved and allowed us to just grow.
Okay, I was just there. I mean, Michaela, she's 10, and she is at a swim party, 22 kids running around the pool, breaks her toe. I don't want to go to the emergency room, and everybody's like, no, go to urgent care, and I did. And emergency rooms are just not the place for every situation.
Emergency rooms are for emergencies, like life-threatening illnesses, life-threatening injuries, and certainly there's been an increased overuse, misuse of emergency rooms, which has done a tremendous burden to our healthcare costs. One study showed that almost 50% of visits in an emergency room probably could have been treated in an urgent care setting.
Interesting, yeah.
And the same goes for urgent care. Urgent care visits are for mild, moderate type medical encounters, not for true emergencies.
Right. And let's say I need an x-ray or lab work. Do your centers in general have that capacity?
Absolutely. NextCare, along with its family of clinics, offers x-ray and on-site lab testing. Our x-rays are digital x-rays. All the interpretations are overread by a board-certified radiologist.
Fantastic.
So an extra level of comfort. We offer rapid testing for common infectious diseases like strep, you have girls, flu, mono, those kind of things.
Yeah.
We also offer on-site laboratory services that include tests for blood counts, electrolytes, liver enzymes, those kind of things.
Well, the level of your services are something that people still aren't aware of. I mean, Michaela walked out with the boot right there. I mean, we didn't go anywhere else. We went to one place. Everything was there that we needed for that broken toe.
Something I commonly hear after a patient encounter is, wow, I didn't know you guys did that there.
Right.
So
that was me.
Obviously,
really
there's a lot more than patients really know about our services.
And insurance is such a biggie. I mean, with cost in mind, just go through the benefits of going to urgent care.
The big two key benefits of urgent care over emergency room, the first being a copay.
Right.
The copay of an average ER visit is $300 or greater. For an urgent care visit, $50 to $75. Big difference. Yeah, definitely big difference. And then if you were to compare the cost of an average visit for a similar encounter, so say you went to the urgent care for strep throat, the bill charges for the emergency room would probably be about 3 or 4 times more.
Wow, that's a big difference. Where can we go if we want to find out a little bit more? Where can our viewers go?
Well, NextCare is an industry leader in the urgent care. We have 100 locations in 10 different states. Most of the clinics are open 365 days a year. We offer a convenient online check-in process. If patients need to know more about NextCare, more about our locations, or some other related urgent care topics, they can find us at www.nextcare.com.
Thank you for coming in.
Thank you.
Great information. I was just there. Thank you for being there for me.
My pleasure. Thanks.
All right, you can also get additional information on this topic by visiting us at thebalancingact.com or get a little social. Log on, share your questions with us at Facebook.com/The Balancing Act Fans.